How concerned should Americans be right now about this Ebola spread?
If we're concerned about the world, we should be very concerned about Africa. It is not a significant risk to the U.S., but there are some things that need to be done, especially by healthcare workers.
The U.S., thanks to you, the CDC, has now gone on the highest state of alert, level 1. What does that mean?
That's what we do internal to CDC. That doesn't mean that other people should be concerned, but that means that we are surging. We're putting more than 50 disease control specialists into the region in the coming days and weeks to help these countries and the World Health Organization turn this around. But it is going to be a long, hard fight.
Let's say someone who has the disease, Ebola, gets on a plane, flies from West Africa to Europe without any symptoms, flies to the United States, and all of a sudden develops symptoms. How contagious would that be? How many more people could in turn be infected?
Well, first off, it's important to remember that Ebola does not spread from people who don't have symptoms. And second, that it only spreads through bodily fluid contact. So what we see in Africa are two main engines of spread. First, in healthcare settings. So doctors, nurses, people who care for people even at home may become ill because they get exposed to bodily fluids. And second is during the burial ceremonies, which in some African countries involve washing the body and other things that are very high risk. That's what's driving the Ebola outbreaks. Whatever we find out about this experimental treatment, the fact is that basic supportive care, fluid management, supportive care, antibiotics for other infections that patients may get, that can drastically improve outcomes and save patients' lives.
These drugs that are out there, there's that one ZMapp, the drug, an experimental a drug that was given to these two Americans who were brought to Emory University Hospital. Seems to have helped, although we don't know the long-term impact. There's another drug, Tecmira, that the FDA has now put on, changed this whole status. Are these drugs really promising? Are they really something that's going to cure people of this disease?
There are a few things to know. We hope there will be drugs available. Right now, we have no idea whether these drugs help, hurt, or make no difference. And whatever happens to these two patients, we're not likely to know anymore, because the natural history of Ebola is that many patients recover. And so there's no way to know whether that recovery will have been, if they do recover, which we certainly hope they do, from these drugs or the natural history of the disease. But the most important thing to understand is we can stop Ebola with our current tools. Core, basic, simple, tried and true public health interventions of finding patients, isolating them, finding the contacts, tracking them, infection control in hospitals, improving burial practices. When we do these things, Ebola goes away, but it's going to be a long, hard fight.